Now, what we're doing at the moment is offering two types of services. We continue to offer the telephone consultation, but we also at all times make available appointments with doctors. Now, I know that there have been various complaints in relation to the PCC. When I started this 3 weeks ago, the first visit, or the first department that I visited, was the PCC. And in addition to meeting with the medical director, I also met with the senior management team at the PCC, the clinical director at the PCC and the nursing director, as well as the head of administration at the PCC. And together I asked them to look at the service holistically, to look at it from scratch, to see how we can improve the services that we deliver to the public. I think there are a few main issues that everyone will know are concerns. We know that there's a problem with appointments and with making appointments, so I've already met with the team at the PCC as well as the GHA's IT team to see how we can find different ways of making appointments available to members of the public. Obviously, we want to go down of the route of e-government to simplify the way that you can book appointments for yourselves, but we'll always have other methods available for people to whom e-government and that is not as simple. For example, elderly people. But the more people that we can steer towards the automation, it means that the more the phone lines will be freed up for those who absolutely cannot use any other method. So we're looking at that. We're looking at ways of changing how you book an appointment to streamline it, make it easier.
We've seen quite a few complaints from people trying to book appointments in recent months, trying to see doctors and other professionals.
We're looking at things that are very simple. For example, before, I know that one of the complaints was that people may be on hold at the phone while other people were calling in, only to be on hold for 30, 40 minutes and be told at the end of it that there were no appointments left for the day. We've changed that immediately, so if when you call, by the time you call there are no appointments, then you'll be told immediately by an automated service on the phone that you're out of appointments. You don't have to wait 40 minutes to be given that message. So it's little things like that that we're doing immediately, but we've also got a bigger plan to see how we can revise it even more. So we're looking at the appointments. We're also looking at how we can make more appointments available by restructuring the way that the PCC clinicians deliver the services. We had a backlog on repeat prescriptions. That's been resolved. We have a backlog in relation to applications for GHA cards. That's better. It's not resolved, but we're looking at resolving it as soon as we can. In addition to meeting with the senior management team of the primary care centre, I've also been able to look at other resources that I have available from outside the GHA so that we can have maybe a more objective outlook from people outside of the organisation. So I have other senior managers from other sectors of the public sector working alongside me and assisting me in these reviews. But at the moment, in terms of my strategy, what I want to do is focus on the primary care centre and see how we can make improvements. There already have been, I think, some very quick improvements. There will be some medium-term improvements, and hopefully in the long term we'll be able to change the way that we do things. I want to hear from the public, because it's one thing for people within the organisation to tell me what they think should be done, but it's another thing for the users to tell me what problems they're experiencing, and I want to hear it from the people themselves. I want to listen to what the problems are, and then I'll be able to analyse it and see what improvements can be made. But generally, I think that we also need to work on a bit of education and what the primary care centre is about, what services we have available, and how best to access them.